So my name is Katie, and today I'm going to be talking to you about the opioid epidemic that's going on in our society, and how we revolve around it and how we interact with it. So as young adults, we are surrounded by all types of substance abuse, whether it be drugs, alcohol, smoking, anything. We are college students, so we are surrounded by it all. And there are a lot of pressures being a young adult, being surrounded by all of these things. But today specifically, I want to talk to you about narcotic abuse for all ages and how it pertains to everyone, because narcotics are consumed by not just people our age, but by our parents' age, our grandparents' age, all of our friends, and all of our family. So there is a quote that I find very shocking from the journal Neurosurgery that says Americans consume 80% of the global opioid supply. So that means 8 out of 10 of us consume an opioid. So there's like 13 people in this room right now, so that means 10 and a half of us consume an opioid or will consume an opioid. So that's pretty shocking. Also from the same journal Neurosurgery, there was a quote that said the U.S. Centers for Disease Control and Prevention, or the CDC, reported 16,651 deaths due to prescription opioid overdose in 2010. So oftentimes you think that deaths are going to be like motor vehicle accidents, suicide, like homicide, stuff like that, but actually overdosing on opioids is actually a very big, prominent thing in our culture, and it's very malignant in our culture. The American Journal of Health Promotion states what starts as pain management rapidly turns into a hijacking of our amygdala's pleasure centers and altering our very brain chemistry. So this is how addiction starts. Oftentimes this isn't something that is voluntary. It's very involuntary. We don't go out and say, hey, I'm going to start an opioid today, I'm going to get addicted, and it's going to control my life. We don't say that. Oftentimes we're prescribed medications and we don't know what the consequence of taking these medications is going to be, and it gets out of control. And like the quote said, it hijacks our amygdala's pleasure centers and alters our brain chemistry. That's how addiction starts, and we don't even realize that it's happening. But something that we can do to be aware of is when a physician prescribes this medication, ask that it's monitored and that's titrated, and ask what the result of taking these medications is going to be. That's very important. Also, another big thing in our society is the stigma that goes along with being an opioid consumer. Being a drug user is not what you assume. It's not being an IV drug user, which is totally different. It doesn't mean that you do heroin or you do these harmful street drugs. That's not what it means. The Journal of Law, Medicine, and Ethics states opioid use disorder is a chronic, relapsing medical condition, not a moral failing. Thus, people suffering from a drug addiction deserve treatment and social support and not punishment. So it's our job to support people that are going through this, because it is kind of considered a disease. Like being an alcoholic, it's an addiction, and it's something that is very painful to go through. And like I had said before, it's very involuntary. It's like getting cancer. You don't volunteer to do it. You don't volunteer to have symptoms of an illness and then get opioids, and then everything goes out of control. Many alternatives that I want to talk to you about today. There are numerous alternatives that can decrease the opioid dependence. The American Journal of Health Promotion states, de-emphasize medication use and emphasize alternative therapies like exercise, meditation, yoga, massage, and acupuncture or acupuncture. So this is very important, and I've experienced this in my personal life because my mom suffers from restless leg syndrome, which is treated like Parkinson's disease. It's very hard for her to live with, but I go to doctor's appointments with her because sometimes she doesn't know what questions to ask, and I'm there kind of to be her advocate, to stand up for her. And the physician recommends alternative therapies a lot, and I've seen how this really affects her personal life. She's done, exercise. She goes to the gym every day. She has done acupuncture, and I've seen how it really helps her kind of wean off of her narcotic use. So it's our responsibility to understand these alternatives. Like, I'm her daughter, and I push her to do these things, like go to the gym and exercise and to be cautious of her consumption. So now that we know that this is a problem, how do we address it? The three things that I have up here are mainly like for physician, patient, things that the physician should be aware of when they're prescribing an opioid. Like before initiating opioid therapy, conduct a history and see how at risk these people are for becoming addicted to these narcotics. Also, initial dosing and titration, which means knowing when you're going to be weaning off of these medications so that you don't become addicted to them in the long run and so you don't become dependent upon them. Also, drug testing, which is strongly recommended because this keeps honesty with the patient and the physician. Also, the physicians need to have patient-centered care. The physician needs to be aware of the patient's needs, what they need. So these are the 4 principles for driving change from the American Journal of Health Promotion. And I like this because this is something that we can do. So we need to know the impact, know what the consequences are for taking these narcotics and how they affect our society, and break the silence, which I think kind of goes with breaking the stigma with being a drug user. Also delivering affordable access, which I've seen personally with my mom. Many times you can fight for insurance to pay for these alternative therapies like acupuncture or physical therapy, and build a cure for well-being. So really being an advocate for the change and going after, taking these steps to make a change. So these are my pictures because I love pictures. My favorite picture is the one that is on the far right, which is all of the healthcare team working together for the patient, knowing what the patient needs, they discuss what the consequences are for taking these medications. They all work together. That's my favorite picture because it's probably the most important thing, and you need to be advocating for that when your family member or you yourself are consuming an opioid. Be advocating for that attention and that care. In summation, the opioid epidemic is a very malignant part of our society, and it causes many problems, and it's our job to raise awareness, and it hits a lot closer to home than you think. Like I said, like 10.5 of us will consume an opioid in our lifetime, so it really will hit close to home, and maybe at some point in your life you will become addicted to an opioid, and maybe one of your family members is addicted at the moment. But through small steps, we can overcome this and help our family members and help ourselves and be advocates for ourselves to know what the alternatives are, and it can really change healthcare. Those are my references.
All right. A little apart. Okay. Amber?
What do you think the best way to advocate the problem is with opioids? Like, how do you think we should go about letting people know what's the best way to do that?
So she asked what the best way